Well, hey, everybody, this is Robert, and welcome to today's show. Now, the cadre of threats facing the nation's water management system is alarming and sobering. Arguably, no menace is more compelling or problematic than Legionella, a waterborne bacterium of major concern here in the US. Now, there's been an increase in Legionnaires disease sweeping the nation in states like New York, Michigan, and Missouri, causing sort of a state of emergency. Uh, a lot of that is because the symptoms of Legionella are very similar to that of COVID 19. So, joining me today to discuss the Legionella bacterium and the available testing procedures is Trevor Craig. Trevor is the corporate director of technical consulting at Microbac Laboratories. Hi, Trevor, and welcome to the show.
Hi, thank you for having me.
You bet. Let's go ahead and start with a little bit about the bacterium itself. Trevor, can you talk about the Legionella bacteria, where it's found, and maybe a little bit of its history here in the U.S.?
Sure. So Legionella is a gram-negative bacteria. It's aerobic. It's commonly found in a lot of water sources in very low levels. It started in the U.S. being identified around the late 70s, and kind of an interesting story. It was found in American Legion Hall, which is where it gets its name, during a celebration for the bicentennial of the signing of Declaration of the Independence in Philly. And a lot of veterans actually got sick from this, around 200 or so. And quite a few of them actually died from it. And from there, it was identified as a unique bacteria. And since then, it's kind of been identified in a lot of outbreaks, and it's always associated with these waters, and kind of in a similar situation and a similar application for who's getting sick, where they're at, and what's happening with it.
Yeah. And it's considered an opportunistic pathogen. Can you define that?
Sure. Most people, if they're exposed to Legionella, are not going to get sick. There's a myriad of diseases that Legionella bacteria can cause. Legionnaires disease is the one that people are most commonly associated with it. And it's going to cause a lot of symptoms that are, like you said, very similar to COVID-19, but it's pneumonia-based. And what you see is a lot of people don't get very sick, or they get sick for maybe a short period of time. But those who have compromised immune systems or prior existing conditions can actually get really, really sick, and it can last for weeks at a time. And the fatality rate of it's actually 10%, which is pretty high when you're talking about a bacteria.
Yeah. Now, Legionella infections have been really increasing over the course of years here in the U.S. Can you address that?
So it's hard to say how it's been increasing over 5 or 10 years. It was only found in the 70s, so that's pretty new, and we've gotten a lot better at tracking this. But when we talk about an outbreak, we're really looking about people with similar conditions at a similar location at a similar time. So it can be really hard to pinpoint if only a certain amount of those people are actually getting sick. And if it's over the course of a long period of time, it can be even harder. Over the last 2 years, we might have seen an increase due to systems being unused. Because a lot of schools were closed, a lot of hotels were closed, a lot of event centers were closed. Places where Legionella does really well have been shut down, and that bacteria has been allowed to grow. So now that they've been turning on and people have started to go back to those places, the infection rate has gone up, or at least it looks like it's going up. We're seeing a lot more infections that are happening a lot closer together with a lot larger groups of populations.
Yeah. And to piggyback on that, what are the most common sources of infection?
So because Legionella does really well in water sources, anything that's going to have sitting water is going to potentially be able to grow Legionella. So we see it in a lot of cooling tanks for large air conditioner units. It's been found in windshield wiper fluid dispersants. It's been found in swimming pools. It's been found in hot tubs. Anything that's going to be able to aerosolize water, and the bacteria in that water is actually going to be a pretty big risk. Right now, you're seeing a lot of outbreaks that are coming up in gyms and in hotels. And in the past, they found out that Legionella can also be spread through soil. It can be spread for miles when it's put into that aerosolized form. So it can really be a big risk for a large area if it's not controlled in those systems that it grows really well in.
Yeah. So if the infections are increasing, what steps are being taken to control this bacterium?
So there's a lot of work out there by people who are much more experienced than me to say exactly what are the best practices. The CDC actually provides us really great guidance on not only how to track your water and what to do with your water systems, but what works really well in killing Legionella. What works in preventing your systems from getting out of hand. So they provide guidance on empty piping, on what to use in your water systems and what to use without your holding tanks to control it. And it's pretty similar to what you would see for things like coliform and E. coli. Those are the same types of approaches. They have, I think it's basically a pamphlet that says what to do, best practices, and how to do it. And it's been really, I think from what I know, that's the best approach to how to control this.
Yeah. Let's go ahead and dive into your specialty, and that's the analytical testing.
Sure.
Trevor, can you discuss the various analytical methods that are utilized by Microbac Laboratories?
Sure. We offer several different methods. Most of them are culturally based, and they are ISO approved methods, or they are standard methods that are used all over, and they are considered pretty accurate. And they use really specialized media to cause specific reactions when Legionella is present. So some of those reactions are a color change, sometimes it's UV light emission, sometimes it's both, to actually confirm that the bacteria that is being recovered is what is there. We do a lot of this testing on a lot of different sources because it can be found in so many places. So it's really dependent on how much you're using and how much you need to be testing for and how frequently you need to be testing for and what the actual regulations are in your area.
Okay, and I would be dismissed if I didn't ask you to tell us a little bit about the company, Microbac. Please go ahead and give us a bird's eye view of what Microbac Laboratories does besides Legionella testing.
Sure. Microbac does a lot of testing. We work in a lot of different departments and a lot of different lines of business. So I come from the food line of business where we do a lot of testing for food quality and food safety, shelf lives, consulting, environmental monitoring. We also do a lot of water testing for things like coliform and E. coli, heavy metals and water sources, and Legionella. So looking at all kinds of different aspects of what's affecting the public health. We also work really extensively in the life science field. With COVID-19, we've done a lot of work with making sure sanitizers are effective against COVID-19 and doing a lot of that research in life science as well.
Oh, perfect. And if somebody wants to get some more information about Microbac, where can they go?
So you can go to our website. It's microbac.com, microbac.com, and you can reach out directly to get a hold of anybody there. You can also talk to look around our website to see the different testing and the different articles. We try to stay pretty cutting edge and post a lot of these things as they're coming up. And we try to work and focus on what's important to public health as well.
Good. Excellent. I want to thank you, Trevor Craig, for sharing your time and your expertise today, sir. I appreciate it.
Not a problem. Thanks for having me.